Thank you. I'm really happy to be here today to talk about weatherization and radon, and basically not just weatherization, which is a national program for low-income folks, but a program I'm interested in anybody who's looking to make their home more energy efficient by tightening it up so that the cold air is not coming in the winter and the hot air is not coming in the summer. And when we do that, there are some risks. And one of the big risks is around radon. And people don't often know a lot about that. And so I would love to be able here to give you some information, help you make some decisions when you do weatherization or energy efficiency work at your house, and move forward in a safe and healthy environment. We believe that energy efficiency is critical because you want to be comfortable, you want to be saving money. At the same time, you want to make sure that your family and yourself are safe. So let's just jump in. What is radon? Radon is a naturally occurring gas that can cause lung cancer. Uh, it comes out of the ground. It's based on what's in the rocks underneath our homes, and what can be coming out is important for us to be concerned about. And some people think, oh, I don't live in an area where there's a lot of granite underneath my house, or there's not a lot of other types of rocks that may be creating radon. Well, we found in places like Florida, which don't have a lot of the kind of rocks, that there can be little pockets where folks can be exposed, and they'll come in and do some testing in that house, and they'll find numbers right off the charts. So anybody is at risk. So if you see a map that says, your house is going to be fine, I would go ahead and have the testing done anyways, because that is a little bit of money gives you some security and safety, and it goes a long way. So again, it's a naturally occurring thing. It's not something that anybody's done that's a problem. It's coming out of the ground, and it's seeping into your home during different seasons, and you won't know it's there because you can't smell or taste it. And the bad thing about it is it's the second leading cause of lung cancer in this country. 21,000 deaths each year are attributed to radon. Comes after smoking. And in fact, if you smoke and you live in a radon belt and you haven't taken care of the radon, it can be even worse. So that is a critical part of what's going on. Uh, Radon measurement is can sound complicated, but it is pretty simple. They measure it in picocuries per liter. The EPA has set a level of 4, and your goal is to keep your home below that. Now, the World Health Organization is actually recommending a standard that's a little bit lower. So if you have the testing done in your house and you can keep it below 2.7, that's even better. But the guidance that the US EPA has put out is 4 is the number, and so that's what generally we talk about. So I think this is the next part is really critical for anybody who's watching this video. How do you test for radon? Our recommendation is go ahead and have a professional do it. Uh, the site here will point you in the direction of a radon measurement professional, and they'll go in, they'll know what they're doing. They'll tell you, exactly where to make sure that you have this device set. They may do it for a week, they may do it for a few days, but they will let you know what conditions you should keep your house under, including making sure that there's no windows open, no doors open that could change the results. You want to have good, solid evidence after you do the testing. But for some people, going out, finding a professional can be, it's one more thing in your day. And so they would prefer to just go out and get their own test kit. And for homeowners, that is allowable. If you're a professional and you're doing it for a professional reason, then there are requirements that you go out and have a radon test done with a professional. But for homeowners, go ahead and you can get your own test if that's better for you. Some states offer discounted tests, and Maryland is one of them. So you can go to the Maryland government website, and I think they're running a deal that's only $4 or $3 for the test. So well worth the effort. If you're listening to this from another state and you're not sure where to go, you can get them from a local hardware store, or Kansas State University has an agreement with EPA that allows them to distribute test kits. I believe theirs goes for about $20 a kit. So you can get those and you can put them in, and then you send them off to a lab, and they will, in a week or so, send you your results and let you know what's going on with your house, whether you're below or above that 4 that we talked about. Now, what they're going to be giving you from these tests are short-term tests. As I said, it's can run from 2 days to a week, and they're generally pretty low cost in the grand scheme of things. As I mentioned, that they're going to want to have you test with your doors and windows closed, so the air that radon is staying in your house. You really know what's the worst case scenario is for the radon at your property. The next thing is to recognize that the standard itself, the 4, is based on a longer term period than 1 week, and so you're just getting a snapshot by doing a short term test. And there is actually variation by season. Uh, we've seen reports that it may be a little higher in the winter when the ground is frozen in a lot of places, but there may be that seam that's just underneath your house that's getting in, and there's conditions within your house with your heating system going on. There's a sort of a draw. It's like a chimney effect in your house, and it's drawing that air up through your basement or your crawl space up into your house, and that's creating a situation where it could be worse in the winter. That being said, there's actually been some recent studies showing that people are running their air conditioning and closing up their house really tight because they don't want to lose that nice cold air in their house. And some people are seeing actually higher levels in the summer for some folks. So it's not a given, but it's just a point to say, if you're going to do nothing, then a week is good. If you're going to do, really want to know what's going on, then the next option is even better, which is you can do a long-term test, which is more than 90 days or more. These can be like the other ones, passive samplers, where the air is blowing past the device and you mail it into a lab and you get the results. There's other more active monitors, but they tend to be more for professional use or research use. So I think you're going to tend to see for even the 90-day test, these device on the left, which is a passive sampler. And again, it gets sent into the lab. These tend to be done by professionals, and they'll come back out. Another reason to have the professionals, they can explain to you what your results mean and give you guidance, not only what they mean, but they can give you guidance on mitigation, what you do about it if your results come out high. So as I said from the start, tightening homes can be a concern. So it's a really good thing. You don't want a leaky house so that your hot air is going out in the wintertime, or your hot air is coming in the summertime. So the radon or the National Weatherization Program has been working since the 1970s to tighten up homes. And they've done a couple of large studies to evaluate how their program's doing. And in 2010, 2011, they, as part of their program, not only evaluated their production and how well their crews were doing in making the homes safe, weatherized and more energy efficient, but they also looked at safety factors. They want to know how well their program was doing as far as keeping people safe before and after their program. And one of the things they looked at was radon. And what they found was that on average, there was an increase of 0.4. And we talked about it before. The standard is 4. So that's 1/10 of the threshold. So if you're close to that level, if you're 3.5 and a 0.4 plus or minus 0.2, that could push you over the edge. So it's important to recognize that tightening up a home can make things worse. And in that same project, they did a mini study afterwards and they looked at 18 homes, not a robust project, but they added bath exhaust fans. And the researchers were able to turn them off and turn them back on 1 week increments. And what you can see from this slide is that the gray bars are when the fans were on, and the white bars are when the fans were off. And you can see that the radon levels are jumping up and down based on having this bathroom fan running. And these fans were run at a low level continuously. So they're continuously clearing the air from the house and getting that radon out of there. And you can see, especially in the winter when the levels are a bit higher, that they were clearing sometimes three, almost four parts per or picocuries per liter of the radon. So this was an effective policy, and this led the DOE, the Department of Energy, to look into this more, to start partnering with EPA on what they could be doing about this. And so the next part, well, I'll be talking about their program and how they've evolved and what we've done as far as a research project to see how they're doing. So if you wanted to see more about this study, it is available from Oak Ridge National Labs. And so this is available for anybody who's interested. So interesting little tidbit factoid that not everybody realizes, but when did radon become such an issue? It's been around for a long time. It's been since the Earth crust was formed, but we didn't really recognize it in this country in a major way until the early 1980s. And there was a worker at 3 Mile Island who, as part of their testing protocols, required all their workers to walk through something to check their radiation levels when they were leaving the plant. And it seemed like almost every day he was leaving, and it seemed like he was setting off the alarm. And he wasn't doing anything that should have been a bad practice. He was following everything, the safety. So one day he decided to run through the test on the way into the property, and it was even worse than when he left. And he realized that actually his home was filled with radon, a radioactive product. It was getting on his clothes, and he was setting off the alarms at a nuclear power plant. So we became aware of it. The US EPA has been involved in helping to support testing and mitigation, support for lower cost tests for people, and they've helped set a standard for when you should mitigate in the country. Uh, they published guidance on what programs should be doing when they are tightening up homes. And um, those included some steps that I'll be talking about a little bit later, but they created some guidance documents that basically divided into here's how you test, here's how you do no harm, let's not make the problem worse, and here's how you can make the problem better. And this was put out both for single family homes and for multifamily homes. And they also provided guidance directly for their workforce on how they should be handling radon as one of their things that they're doing in the house. So all these were documents that were created in the 2010s, and they're in use now with the Department of Energy program. So here's the examples of the documents that I was telling you about. This actually is not just about radon. It's about lots of different contaminants and other safety factors in a home that can be affected when you do home energy upgrades. So this is a really important document. I encourage anybody to go out and read it. I checked today. It is still up on the EPA website, so it's available for you. And for those who are in multifamily settings and working in that area, they have this companion document that is similar, but it has, there's special effects with multifamily. So this is a useful document for those who are interested. So going back to Department of Energy, they recognized right up front, okay, this putting in the bath exhaust seemed to make sense. And so they started requiring that if you tightened up a house to a certain standard, so it wasn't going to be that leaky, that you then had to put in ventilation. And there is a standard out there called ASHRAE 62.2. And um, one of the things that it says is that if you're in certain condition, then you're going to want actually a low level of continuous ventilation in your home. And so it's not good enough to put in a bath exhaust fan that the resident is going to turn on and off with the light switch or have to manually turn on some other way. That's just not giving you enough ventilation. So as long as it's set at a low level with a low sound footprint, then it's going to you generally not be annoying people, and they're not going to disable it, and it's going to work as a good tool not only to get rid of radon, but moisture that can cause moisture problems in the home, and possibly other dust and other things in the house by drying it through the bath and out of the house. Now these should be properly installed, so the ventilation is not just dumping into your attic or dumping into a crevice in your house. You want it to be actually leaving the house and getting out outside. So that's a big part of it. And then they recognized that EPA had this good guidance out there, and they said we should be following it. We should be doing precautionary principles. So some of the things that they said were, if you have a crawl space underneath your house, you should be covering those exposed dirt surfaces with what they call a thermal boundary, basically poly, and sealing it at the edges so that the gas isn't getting in. And if you have a sump pump or a sump pit in your basement, you should be making sure that there is a cover on it so the gas is not getting up through it. So these are the best practices they're putting on. I'm going to say it here. I'm going to say it in the next slide. These are the best practices to do no harm. And that's what the Department of Energy saying. We're not going to buy the radon problem for this program, but we think that other programs like HUD should be funding remediation for radon, but our program is not going to make it any worse for anybody, and that's their goal. But the best practice would be a radon mitigation system, which I'll talk about in a second. So continuing on their policy, the first two are required. These next are allowable, and they are encouraged. So if you've got a basement and you've got potential cracks along the basement, they want you to seal those up. You may want to fill in caulking between that basement and your first floor so that the air is not getting up from the basement into it in case anything does get into the basement. And then possibly crawl space ventilation if things are really tough in your home, you really can't get anything out. That can be an allowable expense under the Department of Energy program. But these are the best practices for their program. The best practice overall is to install a radon mitigation system. And if you've been driving around, especially if you're in Maryland or other places around here, you may have seen these on the side of houses if you don't already have one on your own house. It's a fan on the outside of the property usually. Sometimes it's in the attic, but most commonly you see it on the side of the house. And there is a entry point that goes down into the ground near where the fan is. Sometimes it's co-located with your sump pump if you have one. And it's drawing that radon gas that's coming up through the ground, up through the pipe, and then the fan is drawing it up and then putting it out on the side of your house so that it's giving it enough height so it's not getting into your breathing space when you're doing gardening outside, but it's not going to be shooting up hundreds of feet above your house. It's going to be appropriately designed so it's getting the gas away from your property on a regular basis. So that's a radon mitigation system. These days, I think they're going for 12 to $1,600 if you have to retrofit. We encourage people who are building their own new house to work with their builder to actually set it up so that it goes up through the house. That's where you might find the fan is in the attic. So you don't actually see this on the side of your house. It's actually getting it right up from the basement through the chase up into the fan in the attic and then out the roof like you have other pipes coming out of your roof already. So that's the ideal, but for a lot of houses that had to be retrofit since the 1980s, this is what you may see in your properties. So going again to a little bit more depth on what DOE is looking for. Um, this is the standard fan that you may see in your bathroom. It's going to be set up so that it's set up on so it has a duct work that goes up through the attic or sometimes up through the side of the house and gets rid of your moisture and any other indoor problems that are in the house. So it's a good cycling of the air in your property. So it's a good practice for anybody, but especially if you're concerned about radon on the property. We talked about, air sealing strategies in the basement. EPA has an indoor air plus construction specification, and it's encouraged to follow that when you are doing this. So you don't have to be a weatherizer to do this. If you're doing your DIY home energy efficiency work, this is a good practice as well to go ahead and get your crawl space contained. It also is good for moisture as well. This can be a place where the ground can hold a lot of water, and by putting in this moisture barrier, you're not drawing that into your house, creating any mold in your crawl space, which then could get drawn into your house. So it's a multi benefit step to work on in this way. We talked about the air sealing, the pumps. These are a couple of pictures of putting pump covers so that the water is allowed to get down and gets pumped out of the basement if you have a problem, but it keeps the air from coming into your basement. And these are the drain fittings that you would see around a sump pump that is a way to reduce the amount of air that's coming up. It's allowing the water to go down, but cutting back on any air that's coming into your home. And a lot of us know how to caulk. This is one of the ways to address any cracks or crevices in the basement. So I know that not everybody loves research. It's one of the things that I work on a regular basis, but I'm not going to get into anything like statistical values or anything like that. I'm just going to try to give you the high level information from a study that National Center for Healthy Housing conducted with the University of Illinois in Urbana-Champaign. We did it actually as a two-stage project where we had some funding from the Housing and Urban Development. We worked in New Hampshire and Illinois, and then realized that we probably need a little bit more data. EPA wanted us to collect more, and so with DOE and EPA funding, we were able to expand that project and go to Colorado, Iowa, Pennsylvania, and Tennessee. And Tennessee was good because it was in the summer season. As I said, there's some seasonality, so having Tennessee in was a good opportunity to look at multiple seasons from this work. And we're basically evaluating their program, the precautionary principles that I was just talking about for what they were doing with retrofits. And so we're comparing radon levels before weatherization and after and seeing how well the program was doing. These were not all homes in the states that I mentioned, just a subset of the weatherization homes. And people did volunteer to participate. So this was a volunteer research project. They had to be single family homes with a basement or crawl space. So we didn't have mobile homes or homes on slab. And if they had really low level, then we excluded them from the study. We really wanted to know risk. So we wanted to see what would happen if you were, potentially could have a problem in your house. What would happen when you tightened it up? If you're really in a very low risk situation, that wouldn't help the study. And so what did we find? Again, I'm not sharing the research. There's a paper out there for those who really like to nerd out and look at research papers. But the answer was the weatherization practices were actually working. The health and safety practices, H&S, were working, and the guidance that they were telling for radon. The lowest living area, we were not seeing any differences between the baseline and the follow-up period. And as I noted before, that study from 2010, 2011 had seen those spikes. And so these practices were working and they should be continued. And in fact, what we saw was that the testing that we did right after the work was generally done within 2 weeks or 3 weeks. We found that when we went back a year later for a subset of these homes, we found that the levels were actually even lower. So this is the same season, so it wasn't a seasonality issue. It was just that more time for that ventilation to be working, for that air sealing to be working, and we are getting the levels of the radon even lower after this. But again, this was a do no harm. So there were still some homes that could have had levels above 4, they or right around 4. So it was a concern, and this is a good practice, something we encourage for those who are tightening up their homes, but that full mitigation is still the gold standard for what people should be doing. We were not able to say, oh, what worked really best was the sump pump covers versus the poly being put down on the ground, because we didn't divide up the project. So all we know is we can evaluate the package, and what was being proposed in the EPA guidance document was working. And so we also know that some people thought, oh, I'd love to be able to hear that we don't really need to cover those sump pump holes because it's sort of a pain to get in there and do all that. And that's more of the most costly part of this. We found that 23% of the dwellings in this study actually had unsealed sump pumps before the weatherization. So there was a need. And so we continue to encourage the weatherization program to cover those sump pumps. We also found that in the living space, the radon levels were not going up, but we did see that in the basement, the levels were increasing. And for the most part, people were not living in those basements, so that was not a problem. But we encouraged our report to Department of Energy, we encouraged program administrators to make sure that if somebody was living, if there was any evidence that there was sleeping accommodations down there, that then they needed to do something more. They needed to put in that ventilation in the basement to get that air out of there. So sometimes that poly was working to keep the air out, but sometimes the radon was still getting into the basement. And even though you had the fan up in the first floor or second floor, it wasn't enough to clear out the basement. So that was an important finding that we found. And then I talked earlier about short-term tests and long-term tests. DOE generally does not pay for mitigation, but because of this special study, they agreed for anybody who's participating as a volunteer that if you did have a level above the 4, that they would go ahead and pay for the mitigation. And we actually found that 27 of the homes had higher levels afterwards. Now, many of them had higher levels before, but 27 had higher levels afterwards. But we went ahead and did a long-term test. And what we found was that out of these 27, just 15% had an elevation after the long-term test. So it may have been the season. Often this work was being done in the wintertime, high radon levels. And so on an average level, the the levels were not really on four for as sustained a period that would cause health issues. So I think that was an important finding from the study that we weren't expecting to see. So our takeaway, um, if you're doing weatherization or energy efficiency, whoever's doing it, whether it's the low income program that I was talking about for DOE, whether you're bringing in a market rate energy efficiency provider, whether you're doing it yourself, you should be thinking about these approaches to make sure that you are doing no harm. And if you have the resources, certainly consider having the test done and taking action if you do find that your levels are higher and doing the full radon mitigation system to address those. Now I'm going to pause for a second and just say, my brother and I joke that we had a wonderful dad who was incredibly handy with anything. He could build anything. He was an engineer, and my brother and I both got the logic gene, but somehow the construction gene just passed us by. So I'm going to share some slides that were prepared by one of our partners up in New Hampshire, just giving you a little bit more visual on some of these techniques that were being done. But I'm not going to go into any much detail because that's not my strength. So we'll go through this relatively quickly and then move on to the Q&A period. So it's mentioned air sealing. Here's some examples where you can see around, mastic around different parts of the basement that you're tightening up. So any holes that are going up into the first floor, they're getting sealed up so that there's no way for that radon that may be accumulating into the basement to getting up into your living space. Here's some shots of some of the sump pumps they found up in New Hampshire. They were going in, and as I said, almost a quarter of them had open sumps to start with, or no covers at all. So not even for safety. So they went in, and they also found that not only were there some that were not really covered, but they weren't like they were sort of somebody threw a piece of plywood on top that wasn't really doing much of anything. So they went in and they either bought these, and so some you can get off the shelf, and so they were able to install them. Those are the easiest. But they also did some site fit. So, sometimes it's called a sump pit because it's bigger, it's not round. It was not necessarily professionally installed. And so their crew was able to install these and have a nice tight barrier so that the sump pump wasn't a source of radon coming into the house. And here's the one I think they were most proud of. So it's an example of an area where they went ahead and got it all covered up. And it can be removed, but they made sure that they got this well secured so you're not going to see any radon coming out of this one. And then here's a few slides showing the poly that I mentioned, making sure that if you've got exposed earth, that you're covering it up, keeping that radon as well as the moisture from coming up into your house, and in some cases sealing all the way up to the decking of the house so that you've got nothing coming in, not only from the basement, this could be, you see on one side uh, cinder blocks, the other, I think that actually was a stone basement. And so very much you can not only get it from the bottom, but you can get it from the sides. It's the radon leaking in. So they made sure they secured the property so that to reduce the levels of radon coming into that property. And I think one more or two more. So they sometimes they had to work around ground piers and others, but they were able to, I think the one thing that they did mention is this can get slippery. So if you're in a situation, you got to make sure that workers are doing this safely so that they are not slipping and falling. But once it's installed, then it should be a good uh, opportunity for safety at the property. So I want to thank you for this opportunity. Hopefully this session was useful. I realized that at the beginning I just jumped into this, but I should say that I am the Deputy Director at the National Center for Healthy Housing. I also lead our research effort, and we're a national nonprofit that works out of Maryland. We're proud to be in the state of Maryland. We work on not only research, but capacity building for communities around the country, and we do some policy work. So this was covering our bases. We were working on research, but also informing communities in many different areas about what needed to be done as far as weatherization. And then we went back to DOE and encouraged them to think about their policies. In many ways, their policies were actually in good shape, but thinking about enhancing their policy around livable basements was something that they recognized and put that out as guidance for people. So we're very proud of our work and looking forward to answering any questions you might have. You can certainly reach out to me if you would like to.
Absolutely. Jonathan, do you mind if I ask a few questions?
Oh, please do.
Great. I unfortunately have more questions than time, but this is very, very engaging, especially for an indoor air quality nerd like myself. And I definitely want to thank the National Center for Healthy Housing. This is your second year presenting. Your executive director, Amanda Reedy, presented last year on healthcare financing for healthy homes, which is a very novel concept. I've asked a lot of different people in different sectors that have kind of heard about that, and they're like, that's new to us. So good to know that you guys are kind of on the cutting edge of that. And then, to have you back for year two to talk about radon is awesome. So I guess my first question is how did you find of all the different things that the National Center for Healthy Housing does research on, how did you find yourself in the radon space?
Um, I think that one of the things that really led us to this point was concerns I mean, it was always on our list of, when we talk about what homeowners need to be concerned about.
Mhm,
We recognized early on when we changed, actually were originally the National Center for Lead Safe Housing. So our focus was only on lead and
mhm,
lead poisoning prevention.
mhm,
And we recognized that you know, folks were going in and treating homes for lead, but they were leaving behind maybe the moisture problem, maybe the leaky roof that was causing the paint to peel off the walls.
mhm,
And
mhm,
so we needed to think bigger. The government was also thinking bigger at the same time. And so we worked at about the same pace and changed our name to the National Center for Healthy Housing. And at that time, we recognized there were certain things that were sort of related to lead, like the moisture problems that could be causing the lead to come off the walls.
mhm,
It could be that there's lead and dust, and that same dust may be causing somebody to have an allergy attack,
mhm,
which could trigger asthma.
mhm,
But radon was a little different. It was outside of what we're normally doing.
mhm,
We recognized fairly soon that it was a concern for people and we needed to be involved.
mhm,
But I think when it raised to the top of the list was right around 2010 when this report came out and the Department of Energy were starting to say that maybe we can't do any work in a place that's a high radon zone because we can't make people unhealthy. And we said, no, 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 no. That is just unfair to people. We can have a solution to this, and there are ways to resolve this. You shouldn't just cut off the good work because there is this issue out there. And so
mhm,
we really got involved around that time. But I'm happy to say that I'm on a national committee on radon. This has really brought me in, so it
mhm.
wasn't just a one-shot deal as far as us working on radon. We work on it on a regular basis.
Awesome.
Yeah.
Awesome, awesome. So what's your opinion about consumer grade, high quality, low cost radon monitors?
Um, they actually are generally well. I'm familiar with one product that's out there that actually uses two different sensors in them, so
Hmm.
that they have like a backup system,
Hmm.
which is really good quality.
Hmm.
Often, for many of the air sensors that we're putting into homes, they have a single sensor and they may start to drift over time, and so
Hmm. Hmm.
as long as you're not doing it for critical reasons, I think
Mhm.
that, I've used the general air sensors in my home, and I think that
Mhm.
they're useful. But
Mhm.
as far as radon goes, this is life safety.
Mhm.
Um, it may be different that you're concerned about your carbon monoxide levels in your home. Maybe you're going to feel a little logy if they're too high,
Mhm.
but it's not, unless it's an industrial accident, it's not going to kill you. Where, exposure to radon over a long period of time could be. So you want to make sure it's right. So I think it's useful as an educational tool. Um, and I think that there are some professionals who are starting to use it, and they are allowed to use it in that way. But I would, encourage you to sort of use it as a first step. And then if you see that you're seeing levels, then bring in a professional and have the work done. So use it as a two-step process.
I'm happy that you answered that the way you did, because that leads me into how I come to this space. I've was reading a book during COVID by Dr. Joseph Allen and John McCumber from Harvard called Healthy Buildings. I'm assuming you've read the same.
Yes.
And in that book, it says that radon emits from granite, and we we just put granite countertops in our home here in Randallstown, Maryland, and I freaked out. I was like, oh my gosh, and I've been a real estate practitioner for 25 years, so I've heard of radon, but never ever thought to test my own home. So I went out and got one of these reset accredited air quality monitors that has a radon sensor in it, and not knowing any better, we live in a three-level townhouse. I put it in the bedroom level because in the book it said that the radon can get into your duct system, and because the bedroom is the space that we spend the most amount of our time, there's a good chance that if you're going to get radon indications on the monitor, it'll happen in your bedroom. So that's where I put it. And lo and behold, we were measuring, 15, 20 picocuries per liter, which for folks that don't know, equates to smoking, 15 or excuse me, 20 to 40 cigarettes a day. And we've been here for 25 years. Our son, who recently graduated from college, who still lives with us, lives in the lower basement area. So naturally, totally panicked. It wasn't from the granite countertops. It was because we live in a community called Granite. There's a lot of granite quarries around where we live. The street's named Granite. And I immediately, learned everything that I could about radon mitigation systems. We reached out to we went to the state website, reached out to different companies to kind of give us a quote. Come, we have this. I need a second opinion. Like, what do we do? Um, Two companies gave us a quote over the phone, and two companies were willing to come to the home. How someone can give a quote for mitigation over the phone, I don't know. But two companies eventually came to our home. One wanted to run piping all through because our sump pump is on the front of our home, but of course we wanted the mitigation pump to be at the back of the home. So they were going to run piping all through our basement level, and we'd have to drywall it up, and we were like, we don't really want to do that. And then we were able to find another company that was able out of Mount Airy, an hour away, who was willing to dig down under our slab into the gravel and then suck it out that way. And we saw an immediate change to below 0.4, something like that, on our system. So, and that was 2 or 3 years ago. It's still performing very well. And so that's kind of how I come to the space of, using a high quality, low cost monitor and then getting it mitigated and then really becoming a nerd about it and trying to tell my neighbors like, okay, and then looking on the EPA radon map for Randallstown, it's deep dark red in our whole zip code. Like my
Mhm.
wife and I always joke about when we drive home, just counting all the mitigation systems that we can see throughout the neighborhood. And so,
Yeah, so I mean, I was
yeah,
actually interested because I was just looking the other day at the Howard County Health Department, and while it's less of an issue, you can actually also get radon in your well water.
that's right. That's right.
And
That's right.
I realized that we were actually 4 miles away in our home. I live in Howard
Mm,
County
mhm,
from one of the worst belts
mm,
of radium and radon
mhm,
leakage as far as well water goes. So yeah, we're in a hotbed along this area of the country.
Yeah, unfortunately, Howard County is deep dark red on on the EPA radar map as well, and so that spawned me, becoming a reset accredited professional. Right, we certify buildings for healthy indoor air, and we also started. I was saying earlier, we also started what we call the Indoor Air Corps, where we arm high school students with Uh, radon monitors and particulate monitors and CO2 monitors, and they have a loan program. Now, the students are educated on what radon is and what it's about. They also are educated on getting a second opinion if numbers are excessive. And so no ultimate decisions are made based on any data that we're gathering. And we say that we monitor radon, not test for radon, right? So we monitor for it. And then if we see something that is worthy of a second opinion or a test, then we recommend that the state professionals come in and test and or mitigate. And throughout that process of these students kind of running this radon loan program, we follow the Kansas City or the Kansas State model of their radon monitor loan program. um, Students are actually finding radon in their own homes. Before they started the program, they didn't know what radon was. They didn't know how to measure it. They never heard of it, and then now they're testing it and they're realizing that they do have radon. They're getting engaged with their parents, educating their parents about what it is. They're contacting the professional mitigation company and coming out and doing the mitigation. And that since has grown to our what we call a 30-day healthy home checkup, where we actually deploy radon monitors in the home to check for radon and asthma triggers for 30 days. And it's very interesting. We're finding properties that have mitigation systems where I able to identify that they're not working properly. One of the things that I've read that even if you get a mitigation system, it should still be tested every 2 years. You should still test for radon. Our recommendation is just to be testing all day, every day. We have radon monitors on each level of our home, and the numbers are all different. Sometimes it's higher in my bedroom than it is in the basement level. So that's why I feel like this, testing in the lowest finished level of the home is a great start, but if you have the resources to test throughout, you'll notice a difference in the numbers, which I think is pretty interesting. Um,
And if you don't have the resource to test, I mean, I think that testing is the best way. But if you don't, one thing that we really encourage people to do is if you have an active mitigation system already, that you go and periodically check that little pressure
yeah,
gauge
yep,
that is there, and
yep,
it should be balanced. If it's
yep.
not balanced, then your fan is not working.
Hmm.
And I actually know that um, to actually, when you asked when I got involved with radon, there's the work side of things, but actually, I'm a proud 30-year homeowner. And when we were moving in, this home is it's in Columbia, so
Hmm.
it's a newer home. And so I
Hmm.
was like, well, I don't have to worry about testing for lead. It's post 1978, so I was thinking, I'm free and clear, don't have to worry about that. But one of our partners in the environmental field said, no, you should really test for radon based on where you are. And they came out, and lo and behold, we had a radon problem.
Yep.
And so we've had a rate, we got it as part of the real estate transaction. We got the radon system put in.
Mhm.
And so we've had it for 30 years. But I think it was about 7 or 8 years ago that pressure um, gauge was not balanced. And so we ended up going back out. It may have been the same firm you used because we went out to Mount Airy and had them come out and got our fan fixed, and we're good to go.
And interestingly enough, the home that we measured that had the radon mitigation system was in Colombia. And they purchased it. When they purchased it, the home inspector, somebody tested for radon, found it. The seller put the mitigation system in. So like we got something. We don't know what it is. So they had somebody come back out and double check it. I guess my next question is, why do you think radon testing is not a standard practice in the home environmental assessment arena that normally has these home healthcare workers that typically would check for asthma and asthma triggers? But I'm not seeing that radon testing is part of that process. Why do you think that is, and what can we do to make it more formalized?
I'm going to give you an opinion.
Okay.
This is not a policy of the National Center for Healthy Housing, but opinion that what we've seen is that when we've tried to reach out to the healthcare sector, and as you mentioned, Amanda has done a lot of work in this area.
Mhm.
Um, the way that our system is set up in this country is not the universal payer system, and so it's individual providers making decisions on what's best for them at any one time,
Mm,
and so they're most concerned about what fees they may get hit by in the next 60 days, next 90 days, next year, but not necessarily what they may get hit by in 15 years.
mm,
And so injuries, falls are a huge cost to the healthcare sector. So they want to make sure that home safety, there's a lot of work that goes on, especially in senior housing, about making sure that our homes are safe. And we've got grab bars and ramps and other things in homes to make it safe for that. Asthma is a huge concern in emergency departments.
mhm, mhm,
People coming in
mhm,
with exposure.
mhm,
A little bit less, but still a concern is exposure to carbon monoxide,
mhm,
especially after an event where somebody's using a generator
mhm,
too close to the house or in the house, heaven forbid. Then you're seeing real issues with carbon monoxide.
mhm.
But the radon um, for a healthcare sector is it's a problem down the road.
You would
It's somebody
think.
else's problem.
Mhm,
So there's less of a demand from that sector. And
mhm,
honestly, on the housing side, um, there a lot of inspectors are feeling already overburdened in what they
mhm,
are able to do. And so they're trying to say, we can do the visual things. You give us the protocols, we'll make sure we get those done. But if you have anything that's sort of specialty, whether it's specialty mold testing, specialty testing around the radon,
mhm,
even the carbon monoxide
mhm,
is that there's now cheap monitors they come in and can use. So that
mhm,
so we're seeing a little bit more of that. We're seeing a little bit more of inspectors coming in with moisture meters, not necessarily testing for mold, but checking the if it's a moist condition
leading
that could be
leading
conducive to
indicator.
mold.
Yeah. Mhm,
Those are good first steps. And we're
mhm,
proud of our inspectors for moving in that direction.
mhm.
But I think it's going to be tougher, whether it's home inspectors or code officials, to really sort of buy onto this more technical testing. We're trying, but it's been a challenge for us.
Well, you would think in Maryland that has the slowest emergency room wait times in the nation. Well, excuse me, the longest emergency room wait times in the nation. An emergency asthma exacerbation, can cost anywhere from ten to $17,000 if you need to be admitted to the hospital. My research says that if someone is being admitted for lung cancer because of radon, that's close to 150, $155,000 to resolve that issue. So you would think that, but it's we're new to the space where you can actually now see the air that you breathe, or see that the air that's in a space where we couldn't do that with technology in the past. We now can do that with air quality monitors. So I guess my next question is, Lehigh and Northampton counties in Pennsylvania, my research says has the highest radon levels in the world. I've seen anecdotes of homes measuring at 12,000 picocuries per liter. And folks, just to give you a context of what that relates to, that's 600 to 800 cigarettes a day. Are you finding anywhere else in the planet and in the world, in Maryland, in the United States, that have higher levels of radon than those parts of Pennsylvania?
Um, this is not something I've studied a lot, but I've actually heard people say that Iowa is the radon
Capital.
leader in the country, which, it's surprising to me because I often think about radon being something that's near mountains,
Hmm.
coming out of the ground from that. But whatever is in their soil is creating problems in Iowa. So, um, yeah, I sort of cycle around to what I said during the early part of my talk is that we actually are sort of encouraging people or discouraging people to really look hard at the radon map that EPA has put
Right.
out
Even that map says
because
don't take this map for it. Test yourself. Yeah.
yeah, just test. And if you can get a test from the state for $3 or
Yeah.
even from Kansas State for 20,
Yep.
it's well worth. Or, if you got the money to invest in a one of those monitors that you were talking about, I think that they may be running $200 to $300, maybe a
Hmm.
little bit more.
Hmm.
I know that the standard air quality tests are around 250.
Yeah.
But if you can afford one of those, you can get continuous monitoring, and then you can have the peace of mind and reach out to professional testers if you think that you've got a bigger problem.
Yeah, absolutely. And part of our 30-day healthy home checkup, we've got a small grant from Baltimore Gas and Electric to be able to do this. So this is at no cost. So there'll be a little QR code that people can scan if they want to engage and get a free, no cost, no obligation, no sales, none of that. It's just putting a monitor in your home for 30 days, measuring radon and asthma triggers. Last question. In some places, Ireland being one, because I think Ireland would say that they've got the highest levels of radon on the planet. But sometimes people just don't want to know what's going on with if they have radon or not. And are you seeing that radon is affecting uh, home values in a negative way? I would think it's a bonus to be able to brag that you have a mitigation system. Maybe you've got a monitor that's validating that it's actually performing. Are you seeing any anecdotes about radon mitigation systems affecting real estate values?
Um, I, it's a little bit different from your question, but let me tell you that the whole issue with Department of Energy and their policy that we are not going to be um, getting into the mitigation business. We're in the energy efficiency business, and that
Mhm.
there are other programs in the government that can get into the mitigation business.
Mhm.
But the honest answer is that HUD's program is very small. It's part of their home repair program, and there's a lot of demand for other safety issues within homes. So not all communities are using their dollars for radon mitigation.
Mhm.
So there is a lot of funding, or a reasonable amount of funding for the home testing, but there's less for mitigation. And so one of the things that uh, Department of Energy said is we're not going to mandate that any of our weatherization agencies do testing, because if you give that result to the family and you're in a state that has to disclose, then they're sort of stuck. They have to disclose, but they may not have the resources. If
Right.
you're not able to pay for the energy efficiency, you may not be able to pay for that mitigation system. And so I think that's an area where we are trying to think about policy to make sure that people have the resources if they find out that they have high levels of radon to be able to actually take care of it.
This is the exact reason why the certified industrial hygienist for Howard County Public Schools said absolutely no measuring of radon in our schools. We just don't have the capacity to like we'll do our own every 5 year test, but we don't have the capacity to resolve it if we should find something. So yeah, and very interesting. Jonathan, this has been a fascinating conversation. I really appreciate it, and look forward to working with you more closely in the future. Is there anything that I didn't ask you that you want people to know about you, the National Center for Healthy Housing or Radon?
Um, I will just say that National Center for Healthy Housing is a proud member of the Maryland community, and we are here. We tend to do our work to serve policymakers and government officials and those in that level. So we're not a total consumer provider. So we don't have people come to us on a daily basis to answer their questions about that.
Mhm.
But to be honest, our communications director, who Chris,
Mhm. Mhm.
is fielding calls probably every couple of weeks from
Mhm.
people. So if you've got a pressing issue and you've been listening to this, happy to have you reach out to us. We'll try
Mhm.
to answer it.
Mhm.
Sometimes we don't have the resources, or often we don't have the resources, but we can point you in the right direction, and we're happy to do that. So that we see that as one of our main goals, is to serve the public first by having good policy so people don't have problems later on. But if you do have problems, we'll try to point you to the right direction to have them solved.
And you have done all that for me over the years. I appreciate that. All headquartered in Columbia, Maryland. So we appreciate all the work that you're doing, and look forward to talking to you soon.
Thank you so much.
All right,
Thank you for your
Jennifer, have a
time.
great one. Thank you. Bye bye.